I never thought I would be homeless. My mother died, then my brother died, and then my father died. So it was one thing after another, and by the time I was trying to get it together with them, I had an accident and a tire hit me in the head, and I lost my memory. Then I didn't feel safe with who I was married to, not being able to remember things and not being able to take care of myself. And then after I lost my memory, I was off work for like a year, not being able to work because, you need a memory for any type of job. I didn't trust myself to continue working, and so started living from shelter to shelter, and that's how, I became homeless.
This group of people, we're grouping them together only purely on their housing status. People come to homelessness for so many different reasons. Each person's kind of journey to homelessness is as varied as them. And often it's not one factor, it's a combination of those factors, and it really takes a team approach. So, I'm approaching that patient from a medical lens, but I need our psychiatrists, I need our behavioral health colleagues, I need the social workers especially, because there are so many social determinants of health. And so our goal is to wrap around people completely, and I'm just a piece of that wraparound to kind of encircle them and hopefully end that individual's homelessness.
My name is Dawn Fair. I got to healthcare for the homeless through Santa Maria, and I came here to the dental unit. What happened was I had gotten beaten up, and they stole my car, and my dentures were in the car. So they were generous enough here to work on my teeth and get me these, which enabled me to get a position at Alabama Furniture. I feel fantastic. I feel like a new person. I got the makeup on, and I dyed the hair, and the teeth look great. And when I smile, and when I talk, I can speak now. So that's the most wonderful thing. I can talk to customers, and they would never know I didn't have any teeth before.
I've been a dentist for 37 years. 17 years of those have been in private practice. 4 years have been in corporate dental, and 15 and a half years at HHH. I just delivered a denture, and he started crying. This is like a 67-year-old man, and just started crying in the chair. And I'm like, what's wrong? You don't like them? And he's like, oh no, I love them. And then he said something to me that really hit me in the heart. And he said that I feel human again. That's when I kind of thought, oh, this really is a big deal. I mean, you take things for granted, but for them it really is something that they cherish.
When early on, about the second year of my being affiliated with Healthcare for the Homeless Houston, I met a man named Joseph Benson, whom everybody lovingly calls Cowboy. And he recruited me for this change committee. I had no idea what that was, but he said, just be there. I had a burning desire, once I found out that the change committee was a committee with a voice, to speak for those who yet have not been able to find their voices, and also to give back or contribute to finding out what the needs, the priorities, and the realities of what the homeless community are experiencing.
So basically, the Change Committee is the Healthcare for the Homeless Consumer Advisory Board. I was elected liaison to our board of directors that provide feedback to the board in terms of consumer advice for how we could better serve and better engage our consumers. A new paradigm going forward in the way we treat patients, where you have medical teams that help the patient with self-determination and self-care in improving their lives. And I think I like it because you get better outcomes when you have the patient involved in his own health care.
I'm just on a journey right now to get myself together and to take care of myself, and part of it is my mental health. These people were very professional, very kind, and considerate and caring.
Healthcare for the Homeless Houston in particular is incredible because they are able to do amazing things with very few resources. A lot of the other places I've worked where there's been more financial support or Medicaid expansion or things like that, there's been a lot more funding to be able to provide comprehensive integrated care. Healthcare for the Homeless Houston is doing that, but without that funding. And they're still getting it done. They're still meeting patients where they are, providing them mental health support, providing them medications, going above and beyond to provide that care.